Hello, everyone. Welcome to, I guess this is the first breakout session of the ACS Data Users Group Conference. My name is Bernie Langer. I serve on the ACS Data Users Group Conference Committee, and I'll be moderating this presentation on using the ACS to study COVID-19 in vulnerable populations. I really can't think of a more pertinent topic right now, and it's really great that we can have this conference to look at how we can use this data that's important to all of us on this issue that has clearly been the important issue of the year. Again, my name is Bernie Langer. I'm a senior data analyst at the Center for Court Innovation. Let's launch right into it. Our first presentation is from Samantha Joseph, MPH, who is currently a doctoral research fellow at the Department of Community Health and Prevention at Drexel University's School of Public Health, and is working on the West Philadelphia Promise Neighborhood Project. For her dissertation, Ms. Joseph is studying community trauma and violence as a result of adverse community experiences. And this project will generate a preliminary index for community trauma based on secondary citywide data with input from vulnerable areas of Philadelphia with a history of high trauma exposure. So Samantha, take it away.
Great, thank you, Bernie. I just set up my share screen. Okay. So good afternoon, everyone. Like Bernie mentioned, my name is Samantha Joseph. I'm going to be talking to you today about the development of a COVID-19 urban vulnerability dashboard that our Promise Neighborhood team created, and we used it to inform neighborhood level responses. So first, I just wanted to give you an introduction to the Westerly Promise Neighborhood project. So Westerly, this project is focused on a 2 square mile area in West Philadelphia. It includes 4 neighborhoods and parts of 6 other neighborhoods. It's comprised of a predominantly Black community. And these neighborhoods also experience dramatically higher poverty rates at like 31.5%, a very high unemployment rate at 11.7%, and a lower median household income than the rest of the city at $24,900. And this grant, this project was focused on the previously designated Promise Zone that's HUD designated. And this grant is actually funded through the Department of Education. And so the goals of the grant are very focused on children and families and trying to do programming that's from cradle to career. And we've been working with a bunch of community partners over the past few years to develop programming and to support neighborhood organizations to really reach some of these goals at the child level and at the household level. And you can see here, some of our grant goals include, school readiness and proficiency in core subjects, but also we focus on children and families thriving in healthy, safe and stable communities, which is where we do a lot, as a School of Public Health, we do a lot of focus around building community capacity and really promoting the work of the existing community fabric. There's a lot of really strong community partners that we work with that I'll mention later. As part of our team, we actually have a data and research core on the overall grant. And the research core does a lot of multiple activities, including a biennial survey, development of a case management system, coordinating with the school district and city data. And we also have a neighborhood indicators project. And I lead the indicators team, in which we pretty much create very informative visuals. We work with mostly publicly available data to create a contextual story so we can try to reach some kind of overarching, some of the upstream factors that are driving some of the outcomes that we see at the child and household level. So here's an example of some maps that we create and share out to our community partner. Here's % of adults with a 4-year degree. We usually set pull out our Promise Neighborhood footprint in comparison to the rest of the city. We use a lot of ACS data, and we create these. You can see on the right-hand side, you can see we create briefs and disseminate to our community partners. And so we've had this relationship over the past 4 years or so, in which we create data products. We show them to our community partners. We ask for feedback. We want to know what they want to know and what they need to inform their programming and to share with their partners. And we put them out in very reader friendly and data friendly formats to share. So this COVID dashboard that I'm going to be talking to you about today came out of the indicators team pretty quickly after COVID really became what it became. And we began to think about what we can do to have a little bit more of an accessible way to share about the impact of COVID in our community. So I'll talk to you a little bit about what is the COVID-19 social vulnerabilities data dashboard. So here we are. This is the dashboard that we created in Tableau. And as you can see, we have the whole city pretty much mapped out. And we have all of these features up here, which I'll walk through in a second. But this grant was funded by a small grant through our university, through a rapid response grant. As soon as we started noticing as a country that Black and Brown neighborhoods were experiencing higher rates of COVID-19 infection and mortality and lower rates of testing. This grant opportunity was made available to researchers in the institution, and this received one of those small grants. So the goal was to create this interactive dashboard built in Tableau and GIS. Our team was already using a lot of GIS programming and using, GIS software, and also using a lot of the demographics information that we have shared here. We also built upon the CDC's social vulnerability definition and those measures. So our dashboard shows up here the area of the city that you can highlight, and by neighborhood, so we can highlight specific areas, and I'll show you a little bit some call outs later. And we are able to show percent of population and number, and we can toggle between the indicators. So there's general vulnerability measures, such as socioeconomic status, and then we have a couple more detailed that are specific to COVID. We're also able to show the percent of racial and ethnic groups by census tract to show how the breakdown is for each indicator. So we really developed this tool to inform the COVID-19 response efforts. I think the city, like many cities, was scrambling in the beginning to figure out how best to allocate resources, acknowledging that there were very significant disparities, and there were more neighborhoods that were more vulnerable than others. We really wanted a way that the city and our other partners can identify specific areas for resource allocation. We also wanted to stay true to what we already do. Through the data and research core and indicators team, we provide communities with access to data. And a lot of times they use this data for, to support their grant making or for advocacy efforts. And this became a very high need for our community partners. They wanted to apply for emergency grants, and they wanted to advocate for the allocation of city resources to their neighborhoods. So we have 3 dashboards. I'm only going to talk to you about 2 today. The first dashboard is designed based on the CDC's Social Vulnerability Index. Like I mentioned, these are all pre-COVID-19 vulnerabilities, and these are CDC indicators. The second dashboard are additional COVID-19 vulnerabilities, and this focuses more on the determinants that we know were impacting the COVID rates and the excess burden of COVID on particular communities. So that includes access to resources, health conditions, and housing data. A third dashboard is actually around essential worker data, which came out of an ask of our community partners. I'm not going to talk to you about this one specifically because we have a whole other presentation in this conference. My colleague, Zachary, will be presenting on this on Thursday. So that's my plug for his presentation. So what do we mean when we say vulnerable? Vulnerability that describes the area's risk for a negative impact. So when we're saying more vulnerable, we're talking about neighborhoods that have less access to resources, possibly and more likely due to historic and systemic inequities, and that they have potentially higher exposure to COVID, other comorbidities, and just worse outcomes overall and related to COVID, including disease, death, and the higher economic burden. Our less vulnerable communities have more access to these resources. They have higher ACS, fewer comorbidities, and lower rates of death. So like I mentioned before, this was initially based on the CDC Social Vulnerability Index. Normally, this index is used to prepare and recover from natural disasters, to tell you which areas to focus on. We adapted this based on areas that we knew that would experience the highest burden of COVID-19. And so this really helped us to leverage this framing of social vulnerability and allowed us to push our dashboard in front of people who were thinking about equity in this way. And so once we used this framing, it was very impactful at the city level for us to talk about what would be an equitable distribution of resources. So the tool was developed by identifying indicators based on this criteria. So we wanted data that would be publicly available, which is why ACS data was the kind of foundation for the framework, for the dashboard. We wanted data that's available at the city level and also relevant to the urban context and COVID. So we used ACS data, we used PUMS data, 500 cities data for some of our health outcomes. We used HUD data for the housing and eviction lab. So how that dashboard is structured. So it's a little difficult because the promised neighborhood footprint actually cuts some neighborhoods, some zip codes, and some census tracts up. And so we have to include all of the neighborhoods that in 19104, which is our Westerly zip code. And we looked them, we did the data by census tract so that we can see, although the neighborhoods, as you can see in Mantua, for example, includes 4 different census tracts. And we can see that there are some certain areas of Mantua that are experiencing higher vulnerability than other areas of Mantua. So we wanted to be able to see variations within neighborhoods and also between neighborhoods. It's also possible, like I mentioned in the initial view of the dashboard, it's also possible to search maps by neighborhood or by Philadelphia planning districts. We thought that this was really important. A lot of the decisions in our city were being made at the zip code and at the planning district level, where the city was collecting their information around COVID. And we also thought that this would be, well, actually our partners thought it would be helpful to have information by planning districts so they can advocate to their particular council district members or council members for resources. And so they've been able to really pull together some information from here to talk about the unique needs of their neighborhoods. So what data do we have on here? So the first dashboard is, like I mentioned, is based on the CDC Social Vulnerability Index. So that has SES. These are pretty much all the measures that are already in the index. We took out some that were irrelevant, like under housing and transportation, there's typically a measure for mobile homes. That's not common in Philadelphia. There were none in Philadelphia, especially in West Philadelphia. So we removed that one. But for the most part, we kept the same domains to talk about vulnerability. So SES, household composition and disability, minority status, and housing and transportation. Then if we move to our second dashboard, which is the additional COVID vulnerabilities, we have things that we know became more relevant as we saw how COVID was impacting our communities. So access to resources, including households receiving food stamps, SNAP, public assistance, and then things like no internet, which was really important for telehealth purposes and for homeschooling, remote learning. and then no health insurance. So what's interesting about West Philadelphia is that this neighborhood is called Meds and Eds. Typically, it's high density of medical institutions and educational institutions. So seeing that there were so many people with no health insurance, kind of paints a different picture about what access they have, regardless of whether or not they have the actual services. It's not necessarily a medically underserved area, but still people with no health insurance would not have access to that. And then as far as health conditions, we pulled what, as health conditions were becoming more relevant as risk factors for COVID morbidity, we added them to this list. So we have high blood pressure, obesity, diabetes, heart disease, and then respiratory illnesses such as asthma and lung disease. And then for housing, this was added on later, we added eviction rate, housing units with, that are the housing cost burdened, and subsidized housing units give us a sense about, who's experiencing this economic burden and who probably needs to benefit from resources around creating affordable housing. Excuse me. Our dashboard number 3 is around essential workers, and we looked at by industry, race, and pay, and where essential workers live. So this is what my colleague Zach will be speaking about on Thursday. So here's just an example of one of the issues that we looked at, the potential for looking at the impact of remote learning throughout the West Philadelphia Promise neighborhood. So obviously, internet access became crucial. It's still crucial for us to maintain our lives through the pandemic, and it was pretty obvious that there was a disparity with certain areas that did not have any internet. So as you can see here, we have our base map underneath, and then our Promise neighborhoods overlaid on top. And you can see that this area that's being pointed out in Belmont, over 50% of the neighborhoods do not have access to internet. Of the households, do not have access to internet. So many organizations were working to increase this internet access. At the city level, the school district was giving out Chromebooks. Comcast, which is our internet provider, created an internet essentials package so people can have very low cost internet. And then we had Drexel units that were trying to, increase the data capacity of the communities with digital navigators. So it's very clear to see, if you have very limited people working, navigators to go out, or, Chromebook allocation was scarce, we can see exactly where we needed to focus. And community partners were able to leverage this information to advocate for more support for this area of Belmont. As far as dissemination, we thought that this tool was really good at helping to create that first step in using data for decision-making and advocacy around COVID-19 relief and recovery. We did beta testing with community leaders. We got their feedback. We kind of walked through, as you can see on these PDFs that are on here, we talked about what the tool does. We talked about what each part of the dashboard, how to use it, and community leaders were able to give us their feedback. We also wanted to promote, among other data users, healthcare delivery partners. We worked with our local children's hospital, other community leaders, city agency staff who are working on things related to allocation of resources, deciding where testing centers should go, things of that sort. And we did one-on-one group demos with anyone who asked for one, which was very helpful. And we will eventually publish on the methodology and the impact of this tool. That's forthcoming. So how has it been shared? I mentioned a little bit through our stakeholder presentations, our project management team, our Promise Neighborhood Community Advisory Committee, data partners, the Public Health Department. We created issue-specific briefs around remote learning and essential workers that people can repackage and put in their own advocacy efforts and share with their stakeholders. And then we have a webpage that I hope I can drop in the chat after I'm done. But you can access it through our Urban Health Collaborative webpage. And this is just a list of who exactly we've shared the tool with to kind of give you a sense of the impact. So within the Philadelphia Westerly Promise neighborhood, that's people we work with on a normal basis. And then also we have some civic associations, we have local schools, research connections. At the city level, we have the school district, Department of Public Health, and DHS, the mayor's office, the Office of Community Empowerment and Opportunity, and then healthcare providers such as the Children's Hospital Philadelphia primary care team. CareBot's team is also a primary care provider, Policy Lab. And then at the national level, we were able to present with our NNIP partners, which we love. The Drexel's Urban Health Collaborative is the Philadelphia partner for NNIP. So we're able to share this with that partnership. We had a presentation at the American Public Health Association. We've been sharing and working with Urban Institute on how to amplify the use of the dashboard. And then we also shared with partners at Streetwise. So that's all I have. Here's our contact information, and I hope to share the link with you all so you can check out the dashboard for yourself.
Thank you so much, Samantha. That really touches on so many aspects of data use and dissemination. I know, like, for me, looking at that, it's just so striking how, showing on the map how just blocks from Drexel University and the University of Pennsylvania, there's neighborhoods that have where most households do not have internet access. I think, having that data just is so, it's so striking and so useful for solving what is a public health and a policy issue. So just a reminder to all the attendees that you can submit questions in the question box on the page, on the CVent page. And you can also chat. It's one of the advantages of this remote conference is you can actually chat with each other while a presentation is going on, which wouldn't really be appreciated in person, but is really great in this format. So feel free to make use of that. So I think that really slides right into our next presentation from Jack Mullen on analyzing internet access in New York, with so many people needing to work or learn remotely during the pandemic. It's an issue that really is more important than ever. So Jack Mullen is a research associate at Citizens Committee for Children in New York, or CCC. He is mainly responsible for the collection and analysis of census, administrative, and community-based data that goes into CCC's research products and publications. Jack holds a BA in political science from Vassar College and a master's in public policy, jointly awarded by the Institute of Social Studies in The Hague and the Institute for International Studies in Barcelona. So Jack, go ahead, unmute and take it away.
Thank you, Bernie. Hello, everyone. Wishing you a pleasant Tuesday from Brooklyn, New York. And thank you so much for the opportunity to present and be a part of this discussion. This is my first involvement at an ACS Data Users Conference, but my organization, CCC, has participated in the past, and I'm proud to say that my colleague, Sophia Halkitis, is a member of the Data Users Steering Committee. So on behalf of CCC, I'd just like to extend my thanks and say we're really excited to be a part of this discussion and look forward to learning a lot today and over the next few sessions. So my name is Jack Mullen. I'm a research associate at CCC. And today I'm going to be presenting on how we use American Community Survey data to analyze internet access and inform discussions about digital equity in New York City. So it's the aim of this presentation to leave you all with information on New York City's digital divide, how we apply data from the ACS alongside some other sources to identify barriers, needs, and also resources related to digital equity, and to invite some further questions and discussion for future use of ACS data products on this topic. And so this is what today's presentation will entail. I'll do my best to honor our timeline, but if you'd like to read more on your own time about this analysis that we put together, which was compiled back in April 2020 using 2018 data, you can visit this link at bit.ly/digdivide. But today I'll be sharing kind of updated version of this analysis. So very briefly on my organization, where I'm coming from at CCC, Citizens Committee for Children of New York is a 75-year-old nonprofit with a mission to ensure that every New York child is healthy, housed, educated, and safe. We do this with a mixture of data and research, policy campaigns, and civic engagement to bring New Yorkers together to make the city a better place for children. So internet access has kind of come into our sphere of advocacy only in the last decade or so, but we've really been at the forefront of using data to measure the digital divide in New York City, both prior to and during the COVID-19 pandemic. So every year we collect and analyze estimates of internet access from the American Community Survey, as well as creating our own using the public use microdata sample files, or PUMS files. And so when New York City became the epicenter of the first wave of COVID-19 in the United States, we knew it would be really critical to leverage these data to identify how the pandemic was coming up against many pre-existing divides in access to digital life for New Yorkers. Especially as child and family advocates, we wanted to better understand the situation who might be lost in this transition to the digital sphere. Those who might face barriers to internet access, whether it was actually universal, whether they had access to broadband or cellular data plans, whether they had access to adequate devices to carry out remote schooling or enroll in emergency relief programs online. And so this is what motivated our approach and the questions that are outlined on this slide here. And thanks to the American Community Survey, we have a really invaluable tool of data collection to answer these questions. Now, alongside the ACS, we also looked at data included in this report from the Mayor's Technology Officer, which compiled information from the Federal Communications Commission, or FCC, which captured the infrastructure of internet service providers. And this was useful for us just to get a sense of how many providers households are able to choose from, and if possibly a lack of competition in a certain area has any consequences for the quality of services in an area. So I'm going to quickly review a few of the findings that we took away from this analysis, looking at the 2019 data and how we use specifically the ACS, PUMS data, and FCC data to target how digital barriers are especially prevalent for populations that are confronting greater vulnerabilities during the pandemic. So from the ACS summary tables, which we retrieve using the API actually and the Tidy Census package in R, we looked at internet subscriptions, and we find that close to 500,000 households in New York City are without internet access, and that is no dial-up, no broadband, no satellite, or not even a cellular data plan. And so citywide, this number accounted for about 15% of households, but we also collect these data at the county level for New York City's boroughs and at the PUMA level, the public use microdata area, which is mapped here on the right, and really serves to inform our community partners in a localized way, and also really illuminates some significant disparities within that general 15% figure citywide. And so the map on the right, which is a screenshot from where these data are hosted on our public database, you can see that in certain communities, a lack of internet access affects as many as a quarter to a third of all households in the darker blue shaded areas of the map. If you're not familiar with New York City neighborhoods, these tend to be areas outside of Manhattan, like Brooklyn, Queens, and the Bronx, where we also see lower levels of household income. So we've collected these data over time, and in recent years, the city has obviously improved its overall rate of internet access at 15% in 2019, which is down from 23% in 2015. But we also wanted to note that there remains a lot of progress to be made, especially among low-income households. And again, using the summary table broken down by the Census Bureau by household income brackets, we find that among households earning less than $20,000 annually, more than a third report not having internet access, which is compared to just 5% of those earning $75,000 or more. So these figures tell us about those who lack internet access, but another aspect of the digital landscape that we wanted to explore too is the method through which households are accessing internet. And this is where this dimension of what we call cell-only households come into play, or households for which a cellular data plan was the only means of internet access. And this is actually the case for about 1 in 8 households in New York City, or 400,000 in total. And again, you can gather from the map on the right that there's more to consider when we examine these data at the PUMA level. As you can see, as many as 1 in 5 or even 1 in 4 households in neighborhoods in Queens and the Bronx report that cellular data is the only access to internet. So we consider these data not to say that cellular data is necessarily a problem. And in fact, it may be the more affordable or accessible means for many families. But it's also important to keep in mind that households without a broadband plan are less likely to have a device, and the Wi-Fi hotspots generated by a cellular data plan cannot maybe sustain remote learning or remote work in the same way that a broadband plan can. So then for households who are connected and do have a broadband subscription, we also wanted to look into this aspect of the availability of internet service providers for connected households. So looking at these FCC data, we also mapped the share of competition among internet service providers, or ISPs, by neighborhood. Generally, in contrast to more rural parts of the country, internet services are universally available in New York City, given that every household has at least one broadband provider available. And at the same time, some areas of the city have significantly limited choice. And so the map here illustrates that in some neighborhoods in Northern Manhattan and the Bronx, we note that more than 50% of households have just one internet service provider offering a connection within a census block of their home. And so this is different than lacking internet entirely, but it can still present its own problems or obstacles if the lack of competition among providers is resulting in lower quality or unaffordable prices for internet services in these areas. And we thought it complemented the picture from the American Community Survey data very well too. So using this combination of sources, we were able to really crystallize these different dimensions of the digital divide between the 400,000 households that were relying solely on cellular data plans, and there's 450,000 that were just having one ISP available. And then there's close to 500,000 that lack internet altogether. And as I said, this was as of data from 2018 to 19. And these numbers really put it plain how so many New Yorkers were just left unprepared and in the dark once the pandemic hit and brought the digital realm to the fore of everyone's life. So in this analysis, considering this landscape, we wanted to highlight how a lack of internet impacts specific populations in distinct ways, particularly for children and households living in poverty. So using the 2019 PUMS files, we ran a few cross tabulations of households without internet by other variables, such as the presence of children in the household and the take-up of specific safety net programs. And so we found that there's more than 185,000 New York City children of school age between the ages of 5 and 17 years old who are living in households without high-speed broadband. Obviously, that's a critical piece of infrastructure for remote learning. And then of those without broadband, about half are living in homes that were using just cellular data plans. So that left about 90,000 school-age children with no internet access at all. And then another 75,000 school-age children reported to live in households with internet, but at the same time may lack devices to learn from. That is, they reported that there is no laptop, tablet, or computer in the home. And this was an immediate obstacle that emerged in the transition to remote learning in New York City. And obviously, like Samantha was discussing, required local Department of Education to respond with the distribution of tablets and Chromebooks to meet people's needs. Again, using PUMS data to examine these characteristics of who's living in homes without internet, we also find that many are eligible and report receiving safety net programs like food stamps, cash assistance, and Medicaid. And so we find more than 100,000 New Yorkers reported receiving TANF, temporary aid to needy families, or cash assistance. Were also living in households without internet. More than 300,000 reported receiving food stamps over 2019, and 400,000 were enrolled in Medicaid. All of these populations lived in households without internet. And why was this important for us? I mean, this really means that populations at the time we were thinking about, especially in the immediate shock of transition to stay at home, the populations that were most in need of anti-poverty supports and emergency relief may have faced greater difficulty in accessing those needed services and support online because of the digital divide. And so I wanted to close this kind of data exposition with just a consideration too of how some digital barriers have failed people during the pandemic, but also how those barriers are still presenting obstacles to ending or putting an end to the pandemic right now. Because obviously there's this great news of multiple safe and effective vaccines available and ready to go, which New York City has planned to distribute in principle to the most vulnerable populations and those communities most harmed by the virus. But that plan is very much contingent on digital equity. And practically, when an internet connection is a requirement to make a vaccine appointment, there are hundreds of thousands of seniors without internet who may be left out of this picture. So in general, about 1 in 4 New Yorkers age 65 and older lack internet, but they are disproportionately Black and Hispanic Latino. 25% of Black seniors and 30% of those seniors identifying as Hispanic or Latino lack internet at home, which is a significantly higher share compared to about 20% of white and Asian seniors. So just to keep in mind, as we reach new milestones in vaccine take-up and decisions are being taken to lift pandemic restrictions, it's really, really important to disaggregate public health statistics and all data really by race, ethnicity, because these are the same communities that report lower rates of vaccination in New York City compared to the overall average. So as I mentioned earlier, we host these data on our public database, which you can visit at data.cccnewyork.org. Where you'll find hundreds of other indicators of well-being for children and families, many of which are also construed using American Community Survey data. But I wanted to conclude now with a series of slides to just offer some inquiries, insights, and impact on how these data have been applied in our circles in New York City. And we apply a somewhat similar niche to the Philadelphia Promise Zone, in that we've brought these ACS data to a lot of different audiences, from community-based service providers to policymakers and grant writing professionals. And I wanted to report back on some of the notes and inquiries and feedback on how these audiences have told us the ACS questionnaire might be enhanced. And a first point is just to include an item to account for the costs of internet services that a household takes on. So in New York City, this is specific to our experience, but the greatest barrier to digital life isn't that we lack the infrastructure for broadband, but rather that providers are charging monthly rates beyond what families deem is reasonable or affordable. So it would be really helpful to know how households are budgeting for internet if they are subscribed to this service. And considering that there are already items in the ACS that target expenses on other utilities, such as the cost of gas or electricity, conceivably this could be easily integrated into the survey. Another aspect of survey content for the ACS or possibly other Census Bureau products is questions on children's use of the internet and access to online information and services. One source I could point to is the COVID under 19 survey that's housed at the Center for Children's Rights at Queen's University in Belfast. This is a global survey targeting youth and children aged 8 to 17, and included a range of items on the internet, from how often children are accessing the internet and specific devices to what types of information sources or social networking services they use. And these data have been used by UNICEF and other international organizations to track how digital life has been mediating children's experiences during the pandemic. So that's one thing to note. I'll also note that we really appreciate the efforts of the Household Pulse survey to track educational engagement of students throughout the pandemic, and really encourage the continued monitoring of digital engagement for education or other services for children going forward. And finally, on a more broad point, is the issue of digital literacy. So on top of the digital divide, many partners of ours stress the importance of also digital or technological literacy. And in today's world, if internet access is striving for universality, something that every household should have, then digital competency and literacy is also an imperative for all. It's really just important to assess how household literacy exists on this matter. And I'll note, as Francella Ochillo states from our peers at Next Century Cities, the benchmarks for digital literacy will continue to evolve and will require ongoing community level partnerships on this aspect. In terms of insights, I also want to stress that CCC's approach to understanding the digital divide and applying data to issues of well-being more broadly is complemented by this focus on community strengths and resources. And what I mean by that is also, like Samantha's Promise Zone project was designed to do, that in addition to using the ACS data to measure certain deficits in access, we also make an effort to collect data on community resources that can address internet needs. So to identify data on digital assets that are typically absent from a survey data set, but still speak to the presence of supports that communities are making use of. And so as data users in New York City, we're very fortunate that the city has developed one of the world's leading networks of open data. And using data sets from the local government agencies, our database plots the location of public computer centers, Wi-Fi in public and open spaces, and Link NYC kiosks. And these kiosks are former phone booths that were now converted into a hub for phone or internet use. And we display this on a map to show the presence or absence of these resources in a community to consider alongside access to internet for households in general. And on impact, to end on a more positive note, we're very encouraged to see that policymakers are responding to public pressure and what the data say. I'll say it was pretty gratifying to be recognized by press and public officials in that the figure that we put out on approximately 90 to 100,000 school-aged children without internet was something that many officials ran with, including the New York City Comptroller, as a fact to point to promote better Wi-Fi and digital supports for children enrolled in school. And the New York State governor recently signed a bill to require internet service providers in the state to offer a $15 monthly plan to households where someone is enrolled in food stamps, Medicaid, or other low-income programs, coinciding with the type of analysis that we carried out. And this actually comes in addition to similar provisions that were part of the American Rescue Plan, the emergency broadband benefit, which was just put out by the Biden administration. So I'll just say that these policy outcomes really reinforce our commitment to bringing data, research, and public engagement to improve the lives of New York families. And we're really grateful for tools like the ACS to be able to carry out this fact-based advocacy. So with that, I'll end my presentation and extend my thanks once again to the data users group for this opportunity. And I really look forward to hearing any questions or comments in the remaining time.
Thanks so much, Jack. I remember when this data was first released by the ACS, the internet availability data, and it's so valuable to have that nuance between full internet and only having a cell phone or broadband or not broadband. And so it's great to see that it's being, full use is being made of it. I just want to remind the participants in this conference, in addition to the chat and the Q&A, there's also Twitter. There's definitely discussion about some of these topics using the hashtag ACSConf21, ACSConf21. So feel free, if anything strikes you that you want to share, use that hashtag and can spark some discussion among the broader community. All right. Now, our next presentation is about demographics and disability status of adults living alone in rural areas, looking at ACS microdata. Dr. Jonathan Schrader is a geographer at the Minnesota Population Center and the IPUM Center for Data Integration at the University of Minnesota. He serves as project manager for the IPUM's National Historic Geographic Information System, NHGIS, which is a website that provides free online access to summary statistics and GIS files for the US censuses and other nationwide surveys from 1970 through the present. Schrader leads the development and documentation of new NHGIS data products, including time series tables, which link together census summary data for multiple years using harmonized categories and geographic units. And he also leads the development of integrated geographic variables for IPUM's USA census microdata. As a contributor at the University of Minnesota's Rural Health Research Center, he provides expertise in US population geography, map design, and geographic data analysis. So go ahead, I'm sorry, Jonathan.
Thanks, Bernie. Let me share my screen. Okay, that's working. Great. Yeah, so thanks as always to the conference organizers and to Bernie for moderating. I'm excited to present today on a subject that's still really quite new for me. Bernie laid out where I spend most of my time is on IPUM's data projects, where I'm mostly responsible for just connecting users with data. And on this particular case, for the last year and a half, I've been working at the University of Minnesota with the University of Minnesota's Rural Health Research Center, really directly working on some specific research projects where they wanted some a direct connection to a data expert. And this is kind of the perfect place once I realized that I was trying to think of things I could present this year at the ACS Data Users Conference. And this is a case where I've been able to be a user more than I usually am, and also a good way to present both some interesting substantive findings and some reflections on what works and what doesn't work well with using ACS microdata for this kind of for this kind of analysis. So I want to say that the research subject that I'm presenting on today is about the population living alone, growing population in the United States, and specifically on how that population differs in rural areas compared to urban areas. And I want to credit especially my co-authors, Carrie Henning-Smith and Mariana Tuttle, as the public health experts in this group. The research interest was initially theirs, and I expect they're going to pick this up and keep working towards, we're trying to identify areas of unmet needs and identify policy solutions and potential interventions by various organizations to help this group that is
We may have lost Jonathan for a second. Let's just hold on 1 second and see if he reemerges. Well, while we wait for to see if we can restart that presentation, hopefully we can. This is obviously the travails of a remote conference, but we can actually start maybe some of the questions that we're getting from Samantha and Jack's presentations, and can probably start it fairly easily. We have a question for Samantha. Asked, maybe I've missed, but do you mainly use CDC vulnerability data and ACS to create the dashboards? And I guess the idea is there other data besides that, or are those the main sources?
Yeah, so we started off using the CDC Social Vulnerability Index measures. We used ACS data for those measures at the census tract level. And then we used ACS for a lot of the demographics. And then we used 500 cities data for the health outcomes and HUD and eviction lab data for the housing indicators. So it was a little bit of a mix, but I mentioned that we wanted to make sure that it was all publicly available data and that we were able to have it at citywide and at the census tract level.
Was there non-publicly available data that you would have liked to have used that you decided not to use?
Yeah, so we have some, Philly has a lot of open data portals, but we also have, so we had some there that we were able to think about to lead us to some other COVID specific indicators, but also we had a lot of partners, so like hospitals and other programs that had data that's not publicly available that we would have really liked to incorporate around health outcomes, especially for youth. Oh, we got Jonathan back.
Yeah.
And Jonathan, let's ease right back into your presentation.
Yes, sorry about that. Speaking of internet service issues, I'll share my screen again. Well, let's hope that doesn't happen again. Sorry about that. To continue, I think I was saying that the population living alone has been growing in the United States from fewer than 10% of households in 1950 to about 28% in 2019, with more than 32 million adults now living alone. Living alone is not a direct correlate with health risks and health issues. It certainly can be a positive experience, and we don't want to speak to the many adults who choose to live alone as a preference, and that we support, and we want to support that population. We also are concerned, especially in times like these, that living alone does increase the risk of isolation, social isolation, potentially loneliness, disability, and unmet needs for assistance. So last year, my co-author, Carrie Henning-Smith, published this as an example, op-ed with The Hill, expressing how at this time in particular, COVID-19 and the many measures being taken to reduce social interaction has put this group at particular risk of these sorts of issues. And so we really wanted to explore what types of people would this be affecting at this time. So overall, we already knew that people in rural areas are older on average. In rural areas, they have fewer financial and healthcare resources in non-metropolitan areas and smaller communities. There's older housing stock, and overall, these populations have poor health outcomes. So we're concerned that, there's a combined dual risk of people living alone in rural areas having particular vulnerabilities. And yet in the literature, there has really been very little to report about what these differences are. So this is a great potential use of ACS where the data are readily available and no one has yet delved into this. So in leveraging the ACS, of course, we don't have a lot of detailed health info, but we do have a lot of correlates of health risks. So age, sex, race, ethnicity, income, and of course, more directly, somewhat more directly, disability and health insurance. And crucially for our purposes, we also have household size, so we can identify those living alone. It is a large nationally representative sample, unlike a lot of other health data sources, and because it's a large sample, we get a lot of geographic detail as well, which allows us to distinguish in urban and rural areas. Now, a big question for us is what can we get out of summary tables and what can we get out of microdata? Because with summary tables, we can get extremely detailed geographic information down to specific urban and rural areas, but with limited content. We only can use the tables that have been prepared. On the other hand, with microdata, we get a full range of responses and we can really eke out all kinds of demographic relationships, but we have smaller samples than the summary tables and limited geography for privacy protection. As Jack mentioned before, the pumas that you can identify in public use microdata are, they're called pumas and they have at least 100,000 people in them. So they are somewhat larger. It's great in New York City where you can actually still divide up the city in a lot of different pumas, but in rural areas, it's often many, many counties in a puma. And here's an example of that. This is South Central Texas. You can see several counties along the western border here are all in one puma, this blue outline. And that doesn't mesh well with a lot of the other geographies we're interested in, namely urban and rural. According to census definitions, these dark purple areas are the urban and everything else is rural. Those don't align with pumas at all. Metro areas sometimes align and sometimes don't. So Laredo is an exact match with a puma, but San Antonio is not a perfect match. And so we can't really say very well exactly what the San Antonio metropolitan population is. We can, with summary tables, do all of that. So this is an example of the first phase of our analysis. We worked with summary table data. And one of the things I did was to just map where people are living alone at higher rates throughout the country, focusing on the non-metro areas. The metro areas are in gray on this map. And we see that there's relatively high rates throughout the Great Plains. And a lot of this is correlated with age, we find, but not completely. So there are older populations and older populations tend to live alone. But I want to get back to the limitations of summary tables is that there aren't so many options to choose from. So this is the NHGIS website, and I have selected some filters here up here that will show me what's available in ACS data for our subject of interest. If I was interested in age by living alone, there's only 8 tables available that come up. And most of these, if you were to scroll down, you'd find out are counts of households. So I can't even distinguish the people inside the housing. And then these top 2 tables you see here, one divides the population just above 65, and the other one breaks it into 3 different population categories. So on the other hand, what we do get from summary tables is really fine-grained spatial detail. So through NHGIS and through data.census.gov, you are able to identify specific segments of the population by geographic sub-area. And here I've done that with urban, rural, metro, and non-metro. So this resulted in an infographic where we really focused in on just 2 relationships, living alone by age, by urban, rural, and then again by metro and non-metropolitan. And urban rural, you'll find that actually people live alone at lower rates in rural areas than they do in urban areas. So this is a function of density. So the places where there's a lot of density there tends to be apartments that are conducive to people living alone, and they tend to be at a higher rate in those urban areas. Metro versus non-metro, though, it's the opposite relationship. In the older age groups, 35 and above, we see higher rates of living alone in non-metro areas. So how does that work? I was just describing a density relationship. Well, metro and non-metro doesn't exactly tract to density. So for example, here's a very dense area in a non-metro area in Eagle Pass, Texas, and here's a very low density in area in one of the largest metros in the country, Houston. And so what these results are telling us is that people tend to live alone more often in these denser areas and in less often in these less dense areas, regardless of metro status. But they tend to live alone a little more often in these non-metro areas. In these non-metro urban areas, we expect them to live alone more often, perhaps because there are fewer resources available for living alone. Excuse me, yeah, perhaps because there's fewer resources available to find matches to live with others, I should say. And the next policy brief we worked on, and where I'll focus the rest of my analysis, was using microdata. So we were limited in the tables that were available to us in the summary tables. So with ACS microdata, we were able to ask a broad range of questions. Really, almost any answer to this question we could get from ACS. How do adults living alone differ from those living with others? We have a broad range of options to examine. And oh, my equipment, I am sorry, is just not well prepared for virtual conference presentations. I have lost my screen and I have to go over to my other one. Here we go. So how do those living alone differ between urban and rural populations is what we really wanted to focus on. And again, the problem is, how do we identify metro and non-metro or urban and rural populations at the PUMA level? The last time I was able to present at the ACS Data Users Conference a couple of years ago, co-author and I presented on some new measures we have provided now in IPUMS USA. Firstly, the density measure, which tells us the average census tract density in each PUMA. And you'll see that this Eagle Pass PUMA actually has a higher average tract density than this PUMA over here that was partly in the Houston urban area or metro area. So this gives you a better sense of what people's local population densities are like. And then we have the average CBSA population, so we can identify very large metros versus smaller ones. And then we have just the basic metro classes of non-metro or metro, but there's a lot of mixed. These orange PUMAs, they're neither all metro nor all non-metro. So what we chose to do for our analysis is use another variable called percent metro, PCT metro, which tells you what portion of each PUMA's population is in a metro area. And we simply divide at 50%. So everything that's green here, whether it's mixed or not, becomes non-metro in our analysis, and everything that's purple becomes metro, even though it's somewhat mixed. Bottom line, these numbers are very similar to what we got in the summary tables. So that was a good sign. Despite the fact that there's some mismatch in the PUMA data, our top line figure here is that people tend to live alone more often in non-metro areas at the same rate we see in the summary data. And then we were able to break it down. So first, by marital status, you can see that living alone is very much a phenomenon of the unmarried. Okay, as we would expect, married people tend to live together, and it's these other populations. And this explains partly why we see a correlation with age and sex as well, because as adults age, women are more likely to outlive their spouses than men. So women do tend to live alone more often than men, and they live alone, both men and women live alone more often in non-metro areas than in metro areas. Similarly, across the age spectrum, we see that living alone tends to grow throughout the lifespan. And part of that is the loss of spouses in the later ages. Then moving on to race ethnicity, we see that Black population does live alone at the highest rates. So the group that we would expect to be particularly vulnerable to a number of socioeconomic and health disparities is also living alone at a higher rate. And that's not as true for some of these other groups. And white population, interestingly, there's no disparity between non-metro and metro areas, whereas with most other groups, they do live alone more often in non-metro areas, except for American Indians. That was the one group where we saw higher rates of living alone in metro areas. It's an interesting fact that and this is one of the most striking things I found in our research, was that people with a disability live alone at much higher rates than those without a disability. And this might be partly because of the age correlation, but it's not completely that. You can imagine it may be more difficult for someone with a disability to find and keep a marital relationship, unfortunately. So that could be a factor here, but clearly here there's a compounding vulnerability living alone and having a disability. And if we bring all these factors together, age, disability, and metro status, we see that the group that is particularly most vulnerable are 75 and older with a disability. This is the single group that had the highest rate of living alone across the age spectrum. Interestingly, at some of the lower ages, people live alone less often in non-metro areas, but then as they age, it's the non-metro population that lives alone at higher rates. And across all of these older ages, those with disabilities tend to live alone at higher rates. Breaking this into we used a regression to control for sex and age and disability status and make sure to see whether each of these things individually had an effect. For all adults in household, there's only a tiny, tiny fractional increase in the likelihood of living alone if you're in a non-metro area. So that's what this number indicates. For all adults, you're slightly more likely to live alone. But for those under 75, you're less likely to live alone in a non-metro area and more likely if you're over 75. And then same with the disability. With a disability, you are less likely to live alone in a non-metro area, but more likely to live alone in a non-metro area. And lastly, for both of these things combined, you are much more likely to live alone in a non-metro area. So that was a significant concern of ours. And the result is that those living alone in non-metro areas tend to have higher rates of old age and disability, quite a lot higher, 1/3 compared to 1/4 in non-metro area in metro areas of adults with disabilities live alone. And that's true across all kinds of different disabilities, all of the disability types measured in the ACS. So to summarize, more adults live alone in non-metro areas than in metro areas. But for rural and urban areas, it's the opposite. So living alone increases with density, but sort of decreases with size. And disability, old age, and non-metro residents are compounding factors in likelihood of living alone. And just final reflections on using ACS, there are trade-offs between summary data and microdata. It's important to consider differences between urban, rural, and metro and non-metro definitions if you're using those. And IPUMS provides several options for distinguishing urban, rural in microdata. To close up, it's to acknowledge our funders and thank you, some contact information if you'd like to follow up.
Thanks so much, Jonathan. That was incredibly interesting. Despite the technical hiccups, I barely noticed them because I was really into the presentation. So we'll dive into questions. Once again, please send whatever questions you have in the Q&A box in the CVent platform. I'm also keeping an eye on the chat. Actually, one of our, we have some inter-presenter questions here. I'll let Samantha ask a question to Jack about his presentation.
Sure, thank you. Jack, I was just wondering about internet access stability and thinking about the cost burden that you mentioned as being, a barrier for folks, if that plays into disrupted internet access service throughout COVID.
Yeah, I definitely share this question, but unfortunately, it's only a question to me. I don't have an answer because I'm not sure about a way to measure this in a longitudinal way. We've seen, as I said, the shared households without internet decline over time, but using the ACS data, we're not able to track the same households over time. I wonder if maybe maybe supplemental surveys like the current population survey or something might consider including this, but then you may not get the level of local geographic granularity that we would desire as city-based researchers. So yeah, I mean, we only have indirect inferences that we can draw from, we see the growing number of households using just cellular data plans to access internet, and then the much lower rate of internet access among low-income households that kind of give us this sense that there is some budget rationale or cost burden for families and households that they're taken. But yeah, that's really why I'm really interested in trying to include this as a kind of an item in the survey to get a sense of the cost that people are taking on if they are subscribed to a service. And I know this kind of varies very widely too.
Thank you.
Samantha, another question for you from one of the attendees. Amy Harth asks, do you find that people have difficulty interpreting data shown by tract rather than neighborhood? If so, are there strategies you use to help them understand the connection between tracts and neighborhoods?
Yes, there is, no one thinks about their neighborhoods in sense of census tracts. We've come across this a ton in the work that we're doing with the Promised Neighborhood Project. We actually did in the beginning, we did a couple kind of stakeholder engagement activities where we asked people to tell us what their neighborhoods were. That's one of the downfalls of using Tableau for our dashboard, because you cannot set a neighborhood layer in Tableau while showing census tract data. And since our neighborhoods overlap multiple census tracts, we had to make a decision about, showing census tract data and then just having a drop down in our dashboard where you can highlight neighborhoods by the names that the community, references that area. So we definitely come across this a lot with a lot of our data visualizations, and we usually have a discussion around it with whoever we're sharing the data with, and if we can tailor some of the images to what they need, if they want to show a specific area that overlaps multiple census tracts or two neighborhoods kind of combined, and we do a lot of different edits just to try to tailor the map so that way it makes sense for the story that they're trying to tell about their community. So it's definitely a challenge, and I think it's, since we're producing data that we want them to use for their purposes, we just try to meet them where they are and try to create whatever it is that they need.
Great. And Jack, I think you had a question for Jonathan.
Yeah, and this can be really for either of you, actually. I was just curious in the development of these analyses, whether you considered, I guess for Samantha, maybe if you were looking at any data that were collected over 2020 from local sources, either through municipal agencies or otherwise. And for Jonathan, if you considered any non-ACS data sources to either complement or enhance the analysis at all too, especially on that topic of living alone. I'm curious if there are other sources that track these kind of characteristics.
I'll let Samantha go first. Yeah.
Thank you. So yeah, we've been, so there's a lot going on in Philadelphia right now. We're also experiencing a very high gun violence epidemic. And we have been kind of balancing what that looks like as far as collecting real-time data around violence and shootings, and also the COVID impact. So like I mentioned earlier, it really does have a pretty robust open data portal, but it's not very real time, and it's very difficult to get data out of city units or out of surveys that are traditionally structured a certain way, and now COVID kind of messed up their survey collection. But we're thinking about how to use the data that we do know is available and that is reliable enough, although data collection was difficult over the past year, and we're trying to figure out how to best how to deal with competing priorities around COVID and violence. So we're working on some of that.
Yeah, and for our part, I haven't looked ahead that far. I was focused on figuring out what we could exploit with the ACS data. My co-authors have they did a series of survey questions with, they sought out counties with high rates of living alone in non-metro areas, and sought out organizations who were helping them, talked to Meals on Wheels organizers. And so we did do some surveys ourselves to learn more about the needs of these groups. And I can't right now speak off the top of my head to the major findings of that, but it was productive. Other data sources, I'd be curious to know more about any ideas that anyone else has about good data sources for specifically the living alone population. Which leads me, if I may, to a question I would like to address to Samantha, which was one of the data types that you brought into your dashboard was health data. And I was curious if you could say more about where you were able to get that and at what geographic level you were able to use that.
Yeah, so most of our health data came from two sources. So the 500 cities is CDC data, and it's at the city level. We actually have an awesome statistician that is using small area estimation statistical methods to try to get down to the census tract level. So we were only able to choose or just, visualize data that our statistician felt was still valid after using the small area estimation and getting a census tract estimate. So with the 500 cities data, and then for other health data, we also have a survey that gets put out every other year for the city, and it's through a very large organization that we have here that that's at the zip code level. And so we were able to use the same small area estimation methods to get that down to census tract level. But obviously with a lot of kind of like testing to see whether or not we can replicate it for other jurisdictions, and making sure that there's strong reliability.
That's interesting. Good. Yeah.
So this, I guess, might be for Jack and Samantha, and I mean, Jonathan, if you have any experience with this, but in looking at internet access, I know I've definitely spent some time with the FCC broadband availability data, which is a little bit maligned, but is also, I mean, what it purports to be is block level data on what internet access is available from what providers at what speeds, but it is also self-reported. I wonder if that was something that you'd looked at as part of this, as part of your projects.
Yeah, I'll say I didn't go as far as to the primary source in that sense, because we made use of this report that was actually kind of determining the viability of those data through the Mayor's Office of Data Analytics, and they kind of construed these estimates at the I think it was actually at so in New York City, the Department of City Planning has created what they call neighborhood tabulation areas, which are aggregations of census tracts, which also kind of correspond to, I'm sure they've carried out some community engagement to make these correspond more roughly to what community members recognize as neighborhoods rather than census tract 107.01. So the aggregation of these census tracts allow us to look at these at a pretty minute level, but also with the viability of some accuracy. And based on the work that the mayor's office did, we trusted them to kind of be the shepherds of these data and make use of it that way. But it is worth kind of revisiting the data set now that you mention it.
Yeah, we didn't look at that data. I just wanted to kind of contextualize that this dashboard was really kind of came out of a need, and we were being very responsive to what our community partners were asking for. Now that we have the structure of the dashboard, we're definitely going back and figuring out how else we can add kind of more intricate sources, and try to figure out how else we can use this platform, since it was so well received by our community. So yeah, we're kind of going back now and playing catch up, because we were really just trying to be as responsive as possible and just kind of putting data in their hands when they need it.
Great. So Mark Mather had a question, which is very forward-looking, which is all of the data we're looking at right now is pre-COVID. The last ACS is from, I guess, up to 2019, or yeah. So as we start to get well, I guess, what would you say, data for during the pandemic and then post COVID data, do you have any plans for any types of analyses using that data once it comes out? It's going to be a little while, but it'll be really interesting.
We don't yet. I think that's a great question and really prompts some interesting ideas about what we could be doing.
Yeah, I'll say it is part of our process every September with the release of the summary table data to update our database to be as responsive to the new releases as we can. But I'm very curious to learn more about the quality and the status of the 2020 ACS data collection methods, given, like Samantha was saying, the troubles and difficulties around data collection during a pandemic. So we will probably take extra effort to scrutinize and make sure that the estimates we're getting are things we want to put out there, and we look forward to doing that in the fall.
Yeah, I would echo what John and Jack just said, and also we know that we have a focus. So our team will be transforming into a lab that's going to be looking specifically at data access and dissemination through an equity lens, and we want to focus on the recovery. So post COVID. And so we don't know what that looks like yet. And I'm excited for the other sessions of this conference to learn a little bit more about what that would look like. But we definitely want to be thinking about which communities have the highest burden and will need the most support for recovery.
And Jack, I had one question about one of your slides. This is, I guess, a little bit of a policy question, but when you look at seniors who are lacking internet access, is the goal of that data to try to close the digital divide and increase internet access for those seniors, or is it to look for alternative ways of reaching them that are not internet based?
Yeah, so specifically on the data that broke down internet access among the senior population by race ethnicity. And yeah, that was just a reminder. I think that we really value the disaggregation of data by race ethnicity, especially when we consider like I was saying, the metrics that are being put out now that present a rosier picture of the overall rate of vaccinations, the overall rate of COVID infections declining, the overall rate of deaths declining. But when you don't consider the differences between communities, Black and brown communities in New York City and neighborhoods that are still actually seeing high rates of COVID infection, it's important not to get carried away with these overall averages. When you pay more attention to the details, you find that communities that still face these barriers need more attention. So yeah, it's definitely to inform current strategies to distribute the vaccine. At the time, the senior population, I think when I was putting that together, we're still part of like this first phase of vaccine eligibility. Now that it's available for everyone, we want a comprehensive and holistic approach to getting communities vaccinated. But yeah, it's very important to consider tailored approaches to these problems.
All right. So that's those are all the questions we've gotten, and you all shared your contact information. This video will be shared for anyone to view later if anyone wants to get in touch with any of you. I just want to let everyone know that at 2:30 we're going to have our next sessions as part of the conference. One will be housing analysis using ACS data. That's going to be led by Sean Buchholz at the Federal Housing Finance Agency. And then if you want another session moderated by me, where there's going to be a session on tools and resources using ACS data. And that should also be a good time. So looking forward to seeing all of you at the next few sessions. And thank you so much to Samantha, Jack, and Jonathan for these really great presentations. I definitely learned a lot.
Thank you.
Great, thank you.
Thanks, everyone.